Right. Welcome, everyone. My name is Kara Kaikini, and I use she, her, hers pronouns. I'm the executive director of the Maine State Breastfeeding Coalition. And before we get started, I wanted to take a minute to share a few announcements. One being that this meeting is being recorded and it is available on our YouTube channel. So you can find that if you go to YouTube and search the Maine State Breastfeeding Coalition. You can also share take a snapshot of this QR code, and you can find it that way as well. Plus, if you are signed up for our email list, we send out a link to the recordings of our meetings after as well. Also, we aren't able to offer CEUs at this time, but we can send you a certificate of attendance if that is helpful for you. So after the webinar, I'll be sending an email out to those of you who are attending, and it will include a link to an evaluation. So once we receive that evaluation back, then we'll send you a certificate for you to add your name to. Okay, and if you are watching this recording on YouTube, you are welcome to send an email to info@mainebreastfeeds.org and let us know that you watched the recording, and we can send you a certificate of attendance for that as well. All right. I also wanted to let you know that our next educational webinar is on December 7th, and it is going to be all about breast pumps. I don't know if you also feel like you're quickly losing track of the latest breast pumps that are out there, but I know I feel that way. And Brittany from Acceleron will come on, and she will share the latest and greatest. And we might have some other community members who can share a bit about what they've learned about breast pumps as well. So stay tuned for more info. In the meantime, save the date for December 7th at 12 p.m. And also, we are starting to look at our webinars for next year. And if you are interested in being part of our new professional development committee, then let us know, and we will gather you. We're about to start with first meetings coming up, and that committee is going to be responsible for scheduling next year's educational webinars and eventually a conference. So let us know if you're interested in participating in that. And just a reminder that these webinars are offered for free at this point. We're a small nonprofit operating on the generosity of sponsors and donors, and we want to thank our 2023-2024 annual partners, and we so appreciate any and all donations. So consider making one to support our work so we can keep sending you newsletters and advocating for you and the families you work for. And putting on these webinars and meetings and events and keeping up our social media, all these things, we do need financial support for that. And know that every drop counts, so you can make a donation by scanning that QR code, going to our PayPal page, or if you happen to be friends with me on Facebook, I have a birthday fundraiser that is up right now for the Maine State Breastfeeding Coalition. So we appreciate anything that you can share with us. And then, as I mentioned, volunteering is always an option too. So know that you can you can learn more about our committees or sign up to volunteer through those QR codes. For now, we want to welcome you again to our October educational webinar, all about pasteurized donor human milk in Maine. Kylia Garver is the Director of Hospital Relations and Community Education at Mother's Milk Bank Northeast. She earned her Master of Public Health degree at Boston University with a concentration in maternal child health. And in her role at the Milk Bank, Kylia builds partnerships with a wide range of medical personnel, conducts educational trainings, and supports families and clinical staff who have questions about donor milk. She has 3 children of her own, now well beyond their breastfeeding years, but she continues to be passionate about supporting families, particularly during postpartum. So I want to thank you, Kylia, for being here today, and go ahead and share your screen.
Wonderful. So nice to be with you all today. Thank you so much for having me. I know some of you from other meetings and trainings that we've held, so some familiar faces here today and some new faces, and I'm just so excited to tell you a little bit about the Milk Bank and our work in Maine and some of the opportunities to work with us. So thank you so much to Maine State Breastfeeding Coalition and Kara Her support and the organization's support of our work has been tremendous and has really helped further access to donor milk in the state of Maine. So great appreciation for all the work that Kara and the coalition do to make that happen. So Mother's Milk Bank Northeast is a nonprofit human milk bank. We're located just outside of Boston in Newton, Mass. And we serve all of New England. In fact, we serve some mid-Atlantic states too. And we were initially accredited in 2011. So we have been serving this region for over a decade and have a number of hospitals in Maine that we serve, as well as outpatient families. It's important for you to know we're a nonprofit because our mission is to serve babies and families. We don't have a profit motive. There are some for-profit milk banks in the US, and it's important for you to know that distinction. We are accredited by the Human Milk Banking Association of North America, which is HBANA. We also follow FDA guidelines. We're registered with the FDA. We follow CDC and Health Canada guidelines as well. HBANA accredits about 30 milk banks in the US and North America. We consider ourselves sister milk banks, so we don't compete with one another, we collaborate, and that allows us to share milk. If one milk bank is having trouble getting donations and another milk bank has a surplus, we can ship frozen milk or pasteurized milk to those other milk banks. And this often comes into play when there's a new milk bank that's just starting out. So we try to support one another. We all have the same mission and goal, which is serving infants and families. I think I mentioned we have 12 different states that we serve and over 100 hospitals. Donor milk started out primarily in the NICU, but use in the well baby unit is growing significantly year over year. We always serve our NICUs first. Those infants have specific needs for human milk. All babies we know can benefit from human milk, but infants born before 32 weeks gestation are at risk of necrotizing enterocolitis. And babies with NEC can get very sick, and unfortunately, it's a significant cause of mortality in the NICU. And we know that having access to human milk, mom's own milk, or donor milk, or some combination greatly reduces the incidence of NEC. So we always take care of our NICUs first, followed by special care nurseries and well baby nurseries. And then when we have enough milk to support outpatients, we help outpatients as well. So those are our priorities, and those come from HBANA as well. All the milk banks follow those same priority levels. So who are our milk donors? These are moms of healthy babies that have more milk than their own baby needs. They could also be parents of preterm babies who have more supply than their own infant needs. It could also be a bereaved parent. And we have some programs in place to support bereaved families. We have a bereavement quilt in our milk bank, and we offer families the opportunity to place a leaf in honor of their baby on the tree if they'd like. And all of our donor intake coordinators are trauma informed and trained in counseling support, and we're very aware of what a bereaved donor is going through if they are interested in donating milk. So we try to approach those donors with an extra level of sensitivity and compassion. We also accept milk from surrogates. All of our donors are healthy, and they need to have at least 150 ounces for the first donation and 100 ounces after that. That said, we do not have a minimum for bereaved donors. So if a bereaved donor comes to us and wishes to donate 4 ounces in honor of the baby that they've lost, we gladly accept that milk without imposing that minimum. We do review medications when donors come to us. We also talk about alcohol, drug use, supplements. Folks can't be using marijuana. They can't be consuming alcohol daily, and they need to be at low risk for communicable diseases. So we ask a lot of lifestyle questions similar to what you would be asked if you were going to donate blood. The donor intake process begins with a 15 to 20-minute phone screen. The donor has to reach out to us directly. We don't solicit donors. And so oftentimes that could be a lactation consultant or a nurse or physician seeing a patient in the pediatrician's office. Maybe mom has an oversupply. They can't call us and say, this would be against HIPAA anyway, but that person needs to reach out to us directly. We then have them complete a medical history form, and they are seen for a blood draw. So we test for everything that you would be tested for if you were donating blood, including HTLV, which is a relatively uncommon virus in the US, but it's something that can be harmful for babies. So we make sure we test for that as well. And once all of those test results and the donor intake screening process is complete, the donor receives a donor number. Each donor has their own number, and until they have a donor number, they can't send us any milk. So we accept the milk. Once they have the donor number, we will send them a cooler box. They pack the milk, and we pay for the shipping for it to come back. And FedEx can pick up from their home, or if they live near a depot, they can drop the milk off at a depot site. And on our website, milkbankne.org, there's a donate milk section. Folks can navigate to that donate milk section and complete a pre-screening form if they're interested. They can also see a list of the depots in their area if they're wondering if there's a depot close to home. So after we receive the milk in at the milk bank, there's a process to pasteurize it. As you know, the milk is all in individual milk storage bags. We pool milk. This is a Habana guideline, and we pool the milk to achieve a solid average macronutrient content in each batch. So we know mom's own milk is precisely tailored to that infant that the milk is being made for. And that means calorie counts, protein counts, fat counts can vary. And by pooling, we achieve a consistent average, usually 20 calories or greater per ounce, which is really important for the NICUs that we serve because they fortify the feedings in the NICU and need to know what the base starting point is of the donor milk. We pasteurize using the Holder method of pasteurization, which is 30 minutes at 62.5 degrees Celsius. This is, the milk is in the bottle and warm water is circulating. This just kills any bacteria that could make a baby sick. So if a pump part maybe wasn't very clean or there was something in the milk, it would inactivate that. We flash cool the milk and we take a sample from every batch that's sent off to a third-party lab for microbial testing. Until that testing comes back, the milk can't be distributed. It's in a separate part of our freezer, and it's isolated, so it can't be shipped out until the test results return. So, you know, we might be thinking, well, why do we need donor milk? You know, if a parent, can't the parent provide the milk themselves? And the answer is that is ideal. It's always ideal to have mom's own milk, but that's not always possible. And there are family configurations where that is not possible. So in those instances, the American Academy of Pediatrics and a number of other organizations recommend the use of donor human milk. You can read their position statements online to understand the reasoning, but of course it includes the AAP, MAN, ACOG, and a number of other professional organizations. In the NICU, I mentioned that donor milk has been shown to reduce the incidence of NEC. It's also helpful in reducing chronic lung disease, retinopathy of prematurity, and there's some evidence that it can reduce the length of stay for those babies, which we know is incredibly important because being separated from your infant is very hard for families. And so the sooner they can be reunited and be home together, the better for all. And then in the well baby unit, we're seeing a number of reasons why donor milk is being used. Each hospital might have its own determination for what qualifies as excessive weight loss, but if baby has lost a certain percent, it is below a certain percent of their birth weight, they might need some supplementation while they're inpatient. They could be a late preterm baby with maybe with a sleepier latch that's having trouble completing a feeding at the breast. Maybe a baby that's working through a latching challenge, or mom has a delayed milk supply. We're also seeing some use of donor milk for hypoglycemic babies. So helping to stabilize those blood sugars so that mom and baby can be together and not be separated and not have to go to the NICU. And that can happen in combination with gel treatments that are happening. So a lot of the hospitals now have a hypoglycemia protocol that includes the use of donor milk as an option. And then the very, very exciting news in the state of Maine, you may be aware that donor milk is now covered by MaineCare for certain babies that meet eligibility criteria. So on the DHHS website, you can read the criteria, and I've included a screenshot here. The process for this does take a little bit of work for the family and the provider, but it's possible, and I can tell you we've done it. We've had a couple infants now that have received donor milk and had it covered by MaineCare, and we're aware of those cases because we had to help provide some documentation to get those claims approved. So the way it works is, if a family or pediatrician believes that an infant is a candidate for donor milk and that they qualify, they meet something in the eligibility requirements in the regulation, the provider, the pediatrician, will submit prior authorization to MaineCare, and that's through the MaineCare portal. Then they wait for the decision from MaineCare. And one thing that we've tried to communicate is the urgency of these requests, because babies can't wait weeks on end to find out if they are approved. They need to eat. So you can mark these requests as urgent when they're put into the portal, which will help make sure that they're reviewed quickly. And then once they're decisioned or approved, then the milk bank can send the milk to the pediatrician. The pediatrician will pay the milk bank the processing fees for the milk, and the pediatrician will seek the reimbursement from MaineCare. And it's the amount of reimbursement is set up with the state, so they don't have to worry about that. It's already built in. And then following the MaineCare coverage, Maine also implemented private insurance coverage, and the medical eligibility completely mirrors that of MaineCare. So very positive news for Maine families, and we're very excited to see this coverage. It is, to my knowledge, some of the best coverage in the US so far, in terms of both Medicaid and private health insurance covering donor milk. With private insurance, it's likely that families will need to purchase the milk out of pocket and get reimbursed by their health insurance carrier. Right now, we're not set up as the milk bank to bill individual private health insurances. And navigating this in all the other states that we serve would be administratively not possible for us. But we can certainly help with the supporting documents if someone does wish to support a request for reimbursement to their insurer. They can certainly work with our orders team to make that happen. So turning now to a couple of exciting things happening on the access front, we have received a grant from the Davis Family Foundation. And with this grant, we have embarked on a year-long initiative to increase access to donor milk in Maine. And there are two primary objectives. We want to raise awareness. So we're doing that by meeting folks, getting out in the community whenever we can, disseminating materials, sharing information with OBGYNs, midwives, doulas, lactation consultants, coalitions, everyone that sees patients, public health nursing, WIC, all these great organizations that care about families. We also want to increase access to donor milk as a resource with a focus on central and down east Maine. So we have already some excellent options in the Portland area for folks to obtain donor milk through some dispensaries that are existing, but there are areas of the state that are not as well served. And so we have a real interest in setting up new dispensaries in central Maine and in down east Maine. And so this is where you could potentially help if you have ideas for us, if you have thoughts about a receptive community pharmacy or pediatrician that would be willing to open a dispensary in their community to serve local families. I would love to hear from you. The lift is fairly light. You need to have a freezer, but we do have some funds with the grant to help purchase a freezer. So that wouldn't be an out-of-pocket cost for the dispensary. They need to be able to log the milk that they dispense to families, just recording batch numbers and expiration dates and family names. But beyond that, it's not an incredibly arduous task. But what this could do for Maine families is make it easier for people to access bridge milk, because we know that in the early days of breastfeeding, while we're working through all those little challenges that come up, sometimes just a little bit of supplementation is all that's necessary to support a longer-term breastfeeding objective. So if that donor milk is available in the community, it's so much easier for people to get it than to have to order it on our website and wait potentially several days if they're ordering on a Saturday and we can't get it to them until Tuesday. If it's in the community, it can be accessed in real time and can help support families where and when they need it. So you might be thinking, I don't know if I can open a dispensary, or I don't know if I know someone that would be interested in opening a dispensary, but I would definitely distribute brochures. I'd love to put the rack cards in our office, or I would love to, I'm the HEAL coordinator in this specific area. I'd love to make sure that my families have access to rack cards about donating milk and receiving milk. Please reach out to me, because any and all leads, thoughts, offers to help are more than welcome. And we really need a lot of people to make this work. And so as you can see, the friendship bracelet there on the right, we're all individual strands. And if we can collectively work together and make donor milk available for more Maine families, all of these babies and families will benefit. So I'm going to open it to questions now at this point, and just leave you here with my email address so you can take that down, and we'll put it in the chat too, just in case anyone can't see it on screen. But I'm ready for questions, Kara, if that works.
Excellent. Thank you, Kylia. So any questions, feel free to either unmute yourself. You have the capability to do that, or you can type it in the chat box. And while you're thinking, I would love to hear from the folks who are joining us today about your experiences working with parents who want to access donor milk or want to have it covered by either Medicaid or by their private insurance, and what that experience has been like. Thank you, Kylia, for going over the process the latest with Medicaid and private insurance. We're really excited just in the last couple of years to have come so far so quickly with that. But we, as Kylia knows, we've been wanting to really make sure that this process is accessible for parents before we share it more widely. I think I've had some hesitation from the Maine State Breastfeeding Coalition perspective of wanting to really celebrate the insurance reimbursement, but I'm cautious to share something that isn't yet truly accessible. So I would love to hear if any of you have had experience with families who have been able to have insurance reimburse them for their donor milk or not. So feel free to share your experiences. Is there anyone that wants to share anything now before I go to the first question that came through to me? I know, Kylia, you mentioned that there have been a couple of instances, a couple of families that you've worked with already who have been able to do that. And do you feel like hospitals around the state are more on board now than they were 6 months ago in terms of what they need to do, or is there still work that's being done there?
I think the hospitals are in pretty good shape because they've had donor milk available for patients for some time, many of the birthing hospitals. But I think what remains to be an area for us to kind of expand on is outpatient availability for donor milk and awareness among pediatricians. So, we've been in touch with Maine AAP and some other groups, and they've been really receptive to receiving information about donor milk and willing to get that information out to their members. But because a lot of these babies might need donor milk on the outpatient setting, getting to those pediatricians will certainly be helpful.
Great. And I think there's some pretty fantastic representation around the state here today and beyond. Thanks for joining us from out of state. But everyone here does have a role in this, and I'm sure there's someone you could contact or give information to, or connect directly to Kylia and just say, if there's a particular practice or a location. And opening up a depot, you think you mentioned something about that earlier, but that alone is one way to just bring awareness to donor milk and might be a first step for some locations to just have a freezer somewhere that people can drop off milk that's been, if they've been screened already. And then next step could be maybe having or becoming a dispensary.
Yeah. I can't tell you how many times I talk to someone and they say, I didn't even know you could donate breast milk. People still don't know about human milk donation in the same way that they know about blood donation. So you're absolutely right, Kara. The depots play an extraordinary role in helping build awareness about human milk banking in local communities.
Mm-hmm. Excellent. Okay, Jen, I see that you have your hand up. What would you like to share or ask?
One of my questions is, in the WIC world, we do a prior authorization when MaineCare is going to be covering a formula, and it says that it's a non-WIC item. And that's how some of the PA process happens. Would that be the same with this? And we send that out to MaineCare to say that WIC doesn't cover the donor milk, but would that go, is that part of the process for WIC?
I mean, yes, if WIC is able to enter those PA requests on the portal, then I believe they would be able to follow a similar process to like what you would be doing for a specialty formula.
Yeah, because as soon as we get the prescriptions in, and then we just, we attach them to the form and we send it on. So I was hoping that would make the process go a little faster for them.
Yeah, we like it to be fast because babies need to eat.
Yeah. And Lindsay, thank you. You said you work in a family practice in Skowhegan. You plan to reach out to your education department, see if you can connect them and get more people involved. So awesome. Thank you. All right. And Kim?
Hi. I have fairly recently a family whose baby was born like quite early, and but the baby didn't they weren't early enough that they had to be put in the NICU, and they were denied getting any donor milk because the baby didn't have really any physical diagnoses that would land them in the NICU.
Mm-hmm.
So who could that family, I mean, we can't turn back time, but like if that situation happens, because this family knew of donor milk and asked for it, and they were told, no, just give your baby formula, which he didn't digest as well. So who in the hospital would they talk to if they run into that barrier of staff is just maybe not aware, or without that specific diagnosis, not willing to go through the process?
Yeah. So it's an unfortunate situation, right? Because baby was still probably could have really benefited from donor milk, but for whatever reason didn't fit the criteria for the hospital guideline for accessing donor milk. So each hospital has their own guidelines about who, which infants are eligible for donor milk and for how long. So some hospitals will say if it's a well baby unit, it might be any well baby whose family is working towards providing human milk for them. But other hospitals have narrower criteria, and so they might say the baby must be born before X number of weeks. And then in that case, human or donor milk can only be provided for 72 hours, which, as we all know in lactation terms, is very short. And so it really varies hospital to hospital. But what I would encourage all families to do is always start with asking. When I've been out in the field and have talked with the hospitals, advocating for oneself and your family is so important. And you never know, maybe you had a travel nurse or someone that didn't really fully grasp what the policy covered at the hospital. And so understanding prenatally, especially what's available in the hospital you plan to deliver in, or that your client plans to deliver in, if it's available and for whom, can be helpful. And then I would encourage folks, if they feel like they have a true medical need for donor milk and they're not feeling that the hospital is assisting them with that, they can reach out to the milk bank directly. We have a couple of programs to help subsidize milk for lower income families. So it's possible that they might be able to gain milk through one of those programs if they were struggling to access it in the hospital.
Thank you.
Yeah.
And Deb has a great question. Who sets those hospital policies? I'll let you answer from your perspective why each policy might be a little bit different.
Yeah, so it really, it's the leadership at the hospitals. So they determine when they implement donor milk, the eligibility criteria. And that's not something that the milk bank, we don't get involved in hospital policy because we're not doctors or nurses. And so that's really the job of the providers and the executive teams within the hospitals to determine. And it can be hard for patients because there have been times where maybe a baby was delivered in a hospital that had a more broad policy, but then gets transferred to a hospital with a narrower eligibility and is no longer able to access donor milk. And so it can be confusing. but there aren't any laws that govern and say, you know, aside from MaineCare needing to pay for babies that meet the criteria, there aren't laws that say any baby and patient up to X number of weeks must be offered donor milk.
Right. And is there anyone here who works in a hospital that is using donor milk? I saw some registrations come through. I think before insurance was reimbursing, cost was also a real factor for the hospitals and needing to limit how much they could pay for. And that might change now that insurance is covering it and will be covering more of that. They might be able to broaden that eligibility. But we also want to still be focusing on supporting the lactating parent in establishing a milk supply and in a sufficient milk supply, not having to rely on donor milk as well. So it's a balance that needs to be struck in the hospital in those early days. And it is a different experience for someone who's on the mother baby unit and their baby is there for a few days versus a baby in the NICU who's there for a month or two. And how long is that baby eligible for donor milk? I think is a question that comes up sometimes as well.
Yeah, Tara, that's a great point about, you know, this isn't either or, this is a combination of both, and, you know, access to donor milk and also access to lactation support and counseling to really get to the heart of what is driving a lactation challenge for someone. And so that's why it's so critical when we do provide access to donor milk that there's education alongside it. So always putting baby to breast if that's what the family is doing, or pumping, or however they're getting their milk supply kind of queued up, continuing to engage in those behaviors so that the body doesn't inadvertently start the weaning process. We need more lactation support for sure.
Kylia, can you tell us, I see Alicia saying that Central Maine offers donor milk. Are you able to tell us, and maybe you did and I missed it earlier, which hospitals in the state, like where we have depots, where we have dispensaries, and where we have hospitals using milk?
Yeah, as I understand, I'm not supposed to share all the names of hospitals. I'm not allowed to because some hospital contracts say that we can't. But I can tell you we do have a number of depots and dispensaries in Maine. So if you go to our website, milkbankne.org, and you go to request milk, you can navigate to the drop down and there's a milk depots, or excuse me, dispensaries page, and you can see our dispensaries. And then on the donate side, you can see the milk depots as well. I'm sorry, I can't call them out.
Okay, thank you.
Yeah.
And we have a question about warming the milk. Does warming up the milk remove any of the benefits of the milk? What can you tell us about that?
Yeah, so pasteurization does destroy some, or diminish, I shouldn't say destroy, it does diminish some of the beneficial properties in the milk. But we do know the reduction is not in its entirety. So HMOs are still maintained post-pasteurization. So there's been a lot of studies on this, and you can definitely look up online if you're interested in some of those studies in terms of what is retained. The Holder method of pasteurization is considered, it's called low temp, long time. So it's a less aggressive method of pasteurization than retort pasteurization, which is really high temperature. So because we're not getting to the point of scalding the milk, there's less that's destroyed in the process. But obviously mom's own milk, fresh milk, is always going to be the best in terms of some of those bioactive factors. But pasteurized milk does retain a fair amount of those benefits still. And certainly much more than formula, because some of these things are just not found in formula.
Yeah. Yeah, and I love the FAQs on your website also answer some of these questions. So I dropped that link in the chat as well.
Thanks,
What
Karen.
other questions, other thoughts? Folks are typing right now. I'll ask kind of a final question unless others come through. What if the folks here have a patient or a family that they're working with who wants to see if they're eligible for milk, what do you recommend they do? Do you recommend that they just contact their doctor, and then what if their doctor doesn't know anything about this, about insurance reimbursement and all that? What do you recommend folks here tell the families they work with?
Yeah, I think it's great for everyone to know what the MaineCare legislation covers, what the eligibility criteria is. So having that handy can be helpful, and then clients can take that into their pediatricians if their PD isn't already familiar. I think the pediatrician is the best place to start, because if they do qualify for reimbursement, whether that's MaineCare or private insurance, the pediatrician is really going to be central in helping to facilitate that. But if they're finding they're getting a dead end, or they're just not, their provider is not receptive, they could always reach out to us directly too, and we can help navigate. We get phone calls from outpatients regularly, pretty much every day, looking for answers. So you can always reach out to the milk bank as well.
Excellent, thank you. Oh, another question. Can you provide any basics on insurance coverage of milk, or is there just too much variation on that? Yeah, I think that there's been a bit of variation, but I don't know if there's anything else you want to add, Kylia.
I would add that we know that MaineCare has successfully paid for a couple claims already this year. So we know that the MaineCare process is happening and is sound. I don't personally have knowledge of anyone being successful at getting private reimbursement or private coverage for donor milk, but that could be because they just didn't tell us. So I think that the amount will typically follow MaineCare, but because it's the law now that private insurance cover it based on the eligibility criteria set forth in that legislation, people should be able to get the reimbursement from their carrier. I think, like many things with health insurance, it can be a process to make sure that they honor the benefits that they've promised to their their customers. So it should be happening, but I don't have specific details about private insurance just yet.
Okay. Thanks, Kylia. Any other questions? All right. Well, thank you so much for joining us, everyone, and Kylia for sharing this really great information. And we have your contact info if anyone has any further questions for you. And you can also reach us at info@mainebreastfeeds.org, and enjoy these gifted 14 minutes of your day. And we look forward to seeing you again soon. Thank you.
Thank you so much, Kara. Thank you, everyone.